Hey everybody, welcome back to another I Care for Your Brain with board certified neuropsychologist Dr. Karen Sullivan. That is me. Tonight we're going to be talking about a current event. Could a traumatic brain injury be to blame in the CEO shooter case? So this is a brain-based theory of the why. Why did Luigi Mangione kill Brian Thompson, the top executive at United Healthcare? This is the largest U.S. insurance company. This young man was seemingly full of promise and potential. The world was his oyster. He was a graduate from an elite private school, a valid Victorian, a frat guy. He had a master's from an Ivy League university, UPenn. What in the world happened to turn this kid into this guy? As a neuropsychologist who completed a 2-year postdoctoral fellowship in polytrauma at the Boston VA through Harvard Medical School, I think maybe I have an interesting, unique angle on the why that you maybe haven't heard yet. As neuropsychologists, what we really do is focus on why and how somebody changed from their usual baseline. And we know a lot about this kid's baseline. By all accounts, he is a classic overachiever from an upper middle class family, maybe even upper class, prominent Baltimore family, a young American who seemingly was given every conceivable leg up. His Instagram shows him traveling to tropical destinations, hiking with different friend groups, being an embraced member of several social tight-knit communities. This kid clearly played by the rules of society at one point, but he's now accused of taking a man's life in a radical act of violence. Now, just because on paper somebody has all the credentials for being kind of an upwardly mobile individual doesn't mean that they're immune to having life traumas. And we really don't know a lot about Luigi's inner world at this point. There was one report this morning that said on a internet page related to books people want to read, he had on there, I want read adult children of emotionally immature parents, how to heal from distant, rejecting, or self-involved parents. Just a minor little point that maybe even from his perspective, he felt that he did have a history of early lifehood trauma. This has many people stumped. The only factor of the why that's really been put forward, as far as I can tell in the media, is that he had a back injury that was related to a surfing accident that he had in Hawaii, and this required a surgery to pin his lower spine together. Media reports have talked about him going crazy after the surgery. So I want to unpack that a little bit and give you some different new insights into what that could possibly mean. So the presumption is that through his back injury, he became painfully aware of the horrors of the United States healthcare system that I think most of us listening today would know are unjust and unfair, causing much too much unnecessary trauma and grief on top of a medical crisis that you're trying to deal with. Anyone who has had to interact with American healthcare companies can tell you that it is a special ring of hell. It is a broken system. It is heartless. All Americans would agree that we believe, I'm pretty confident about this, that corporate healthcare boards prioritize profit over true person-centered healthcare. The system is hella greedy. Nobody is going to disagree with that, and desperately needs to be rebuilt, completely dismantled, and have a disruptive technology completely redo it. That is, the system we have right now doesn't truly focus on health and wellness. The United Healthcare last year in 2023 made a $20 billion profit while denying 1/3 of their claims. And it is disgusting. And yet, I truly believe that rational, sane, brain healthy people know that even though this is extremely egregious, that it is no reason to take a life, to kill a husband, a father on the streets of New York City. So something has happened here. So there's basically 4 possibilities as I see as a clinical neuropsychologist. 2 have been addressed publicly, and I bet 2 you've never heard of yet. So the first one is that this kid, Luigi, is a radical social vigilante, right? And that he's got some kind of personal vendetta related to a back injury, being a person who lived with what sounds like severe chronic pain. So some are speculating perhaps he had a claim that was denied. He somehow had firsthand knowledge of the terrible, bitter, cold hand of healthcare. We don't even know if he actually had United Healthcare. I think that's an interesting point. Was this even his personal carrier? So that's one possible explanation, is that he was completely in his right mind, completely rational, and that this was a well-reasoned, well-thought-through attempt at righting a social wrong. Number 2 is that Luigi has a major mental illness that includes a psychotic disorder, a delusional thought disorder, perhaps schizophrenia, that made him believe that this act of violence would somehow avenge the evils of the healthcare system and create some type of justifiable impact. Or number 3 is that his back injury perhaps also could have included a yet undisclosed impact on his brain. And I think as a neuropsychologist, that's where I'm hoping to offer something that is unique. So we're going to go through what we know about his back injury and say, is it possible that he also has sustained a traumatic brain injury or a TBI? I have come to believe that I think this is at least a potential possibility. Or number 4, and this might actually be the most realistic one, could it be a combination of all 3 of these things? A person who had some type of vulnerability to a major mental illness, had a catastrophic stressor and nagging, horrible ongoing pain, and maybe also did have some type of brain compromise. And we're going to talk about how all of that might come together. In my 12 years of analyzing people as a neuropsychologist, I can tell you most of us are much more complex than we appreciate, and there's usually more than one explanation for complex phenomenon. So what evidence do we have from the vigilante perspective? Well, it's obvious, right? It was clearly targeted at the CEO of the biggest United States healthcare company. And apparently in his notebooks, Luigi said these parasites simply had it coming. So we know that there was at least a thought in his mind that this was justified. So we know that there is some type of social cause related to this. And supporters of this kid, which he has a lot of, have said, it is not right for someone to decide who lives and dies. But that's essentially what the CEO, i.e. the healthcare system, does every single day, that it's an eye for an eye. And I think it's up to each one of us to decide which one of these feels like it rings most true. Number 2, the evidence for the major mental illness. So he's right at the age for the development of a psychotic disorder. He's 26, so early to mid-20s for men is the most common age of onset. He also has a high IQ, we can be sure, because of his education. And so this is actually a risk factor for developing a psychotic disorder. IQ has an incremental relationship with schizophrenia, as just one example, across the IQ range. So for every increase in IQ point, you've got a 3.8 increased risk for developing schizophrenia. It's very important to know if he had any family history of any major mental illness. Perhaps he had a genetic vulnerability, and then there was a significant psychosocial stressor. This is a very common way that psychotic disorders reveal themselves. So in this case, people have said after his back surgery that this changed everything and that he went absolutely crazy. So for some people, this can be enough of a stressor to perhaps unleash some type of a genetic vulnerability. There's also some reports online that perhaps he was dabbling in psychedelics. And for many people who are genetically vulnerable to major mental illness, a drug experience can tip them over into a psychosis or delusional thinking. So they basically based this on his Twitter. There's this cartoon picture of a mushroom, and he reportedly was reading a book called Psilocybin Mushrooms of the World. He also retweeted a video of podcaster Dr. Andrew Huberman's discussion of psychedelics called What Does the Research Say About the Personal and Societal Risks of Particular Psychedelics versus Alcohol? So, okay, him and many other people are interested in psychedelics. Not that big of a deal, but It's just, we're trying to tie links together to explain a very hard to understand phenomenon. Number 3, this is the main point of my talk today, is this possibility about a TBI. I think it's something to consider given a few things that have been reported in the media. So we know that he had a traumatic spinal injury, and it's also been reported that it actually affected the spinal cord. The spinal cord is part of the nervous system. The brain and the spinal cord are what make it up. So we can say he has had a neurological injury. We don't know much about the surfing accident at all. Some media outlets are reporting that it was specifically related to a surfing accident, and I've read other places that it aggravated a long-standing spinal condition that he's had ever since childhood. But what everyone seems to agree on is at some point in Luigi's journey, he was in excruciating back pain. If the surfing accident was caused by a mechanical injury, meaning he got hit really hard with a wave or a board, then it is conceivable that in that same injury, he could have also experienced a traumatic brain injury. Now, if it were a TBI that happened, it wouldn't just be any blow to the head. It would actually have to have 2 very specific characteristics. So the first is it would have to be much more than a mild traumatic brain injury, which we also call concussions. The way we grade TBIs is into mild, moderate, and severe. And the way we grade them is based on the length of time someone is unconscious and the length of time that someone cannot make any new memories. We call this post-traumatic amnesia. And considering the seriousness of the lumbar back injury that we have heard that he has, to the point where he allegedly needed 4 pins to repair and hold his lumbar spine together, there's evidence to suggest if he did have a mechanical injury from a wave or a board, that the force was severe. So a loss of consciousness in a case like this, it would have to be over 30 minutes. So that's really important. Many people have blows to the head where they are slightly dazed, or they're not even sure if they really blacked out, or maybe they were out for like 30 seconds. That is the most common type of brain injury. So think about that. You would have to be unconscious for 30 minutes for this to classify as a moderate brain injury. And in my opinion, it would need to be moderate to have these kind of long-standing effects. People who are unconscious for less than 30 minutes, the literature tells us very almost always make a complete recovery within 3 months. And when symptoms linger, we think about things like chronic pain, stress, depression, how did their life fall apart at that time, medication effect, things like this, impact on sleep. So for a moderate traumatic brain injury, he would have had to have been unconscious from 30 minutes up to 24 hours and have a 1 to 7 day period of no memory around the time of the TBI. For a severe TBI, it would be 24 hours of unconsciousness and over 7 days that he has no memory of, is never going to make a memory of. His brain encoding system was not working to make memories. So in social media accounts, supposedly Luigi posted this picture. This is an X-ray photo of screws and a plate attached to someone's lower back. It's been reported that on his Reddit page, he said he had an L5-S1 spinal fusion in 2024. ABC News reported yesterday that he was active on a community page on Reddit called Brain Fog and posted in 2018 about having cognitive symptoms, and that these cognitive symptoms made him feel that his life had been halted and that he was socially alienated because people didn't understand what it was like to live with brain fog. There's also been some reports that maybe he had another accident where he slipped on a piece of paper. I have no details about anything specific. I just think that considering a traumatic brain injury in someone who's had a significant change from their baseline in terms of social behavior is worthy of your time and thinking about it a little bit. Many people have brain fog and it's got nothing to do with a traumatic brain injury. But what we're thinking about now, is there a clinical syndrome that possibly fits together? The second thing about a TBI that would have to be true for this to make sense is it would have had to have been a bifrontal lobe head injury, in my opinion, meaning both the left side and the right side would have had to have an injury. So that can very easily happen, of course, if you get hit like this, if a massive wave came at him like this, or a surfboard, or he collided with another surfer. It can also happen if you get hit really hard in the back of the brain, which maybe is more likely considering he had a back injury. And this is when the frontal lobes slam up against the inside of the skull. The outside of the skull is very smooth, and so we often sometimes think the inside is also smooth. It's not. The inside is very bony, it's very pointy, and when the brain moves in space at a high velocity, it is very easily damaged when it bumps up against those bony protrusions in the skull. So you can see through this picture here how that might happen through the force of the collision. The brain is compressed into the skull, basically twists around and jostles back and forth in the cerebral spinal fluid. So you can see in this picture of the skull here, imagine that all of those ridges that you're seeing are basically points that are very, very sharp. If you've ever seen the inside of a horseshoe crab shell, that's what it always reminds me of. So in bifrontal head injuries, this can cause a frontal lobe syndrome that causes severe social and behavioral symptoms. The extent of the consequences, because it's bilateral, meaning both sides, is more impact because you're less able to compensate with the other side. So these folks with bifrontal injuries can actually have normal cognition if you're to just judge it from the outside. We know that this kid traveled independently. He allegedly made parts of a gun with a 3D printer. He got a fake ID. He figured out how to use cash and go use taxis and go to a hostel. Apparently set up a blocking device so his cell phone could not be tracked. And yet somebody with a moderate to severe TBI in the bifrontal lobes could have done all of that cognitively and have a very distorted sense of judgment and zero neurological ability to appreciate the fact that his thinking was perhaps delusional and that the killing would have no impact ultimately on his social justice cause and cause him to potentially go to jail for the rest of his life. Now, some people would argue that he knew exactly what he was doing and he was willing to take that chance, and that's fine. We're all entitled to our opinions. But from a clinical psychological perspective, I certainly think it's worthy to consider if perhaps there is a psychological or a neurological injury that's going on here. So in bifrontal brain injuries, delusional thinking can happen, poor reality testing, beliefs that can be based a little smidge in reality, but they get blown up in the person's mind and do become paranoid or persecutory, where they think other people are actively trying to harm them. There's been some reports that his back surgery was successful, that he actually a month before was seen hiking in Southeast Asia with a big smile on his Instagram page. So it's really hard to understand what role chronic pain played in his life, but there is the report that it certainly was something that happened to him at some point. So could it have been a little seed of an experience that in the context of a brain injury and impaired executive functioning and judgment increased a heightened sense of suspicion or distrust? People with this type of brain injury can have really, really big ideas that feel very, very important to them. They can feel omnipotent, almost as if they are called to do something fated, something very meaningful, like the weight of the world is on their shoulders, and if they don't do something about it, something catastrophic will happen. Their thinking can get pretty distorted, and they can have a delusion of perceived power. So apparently he was at least somewhat of a fan of the Unabomber, and apparently wrote, "When all other forms of communication fail, violence is necessary to survive." So that kind of gets you into his thinking that did he think somehow he needed to survive to kill this gentleman, that it had something to do with his very ability to live. He went on to say, you might not like the methods, but when you see things from his perspective, it's not terrorism, it's war and revolution. So that's really for us to decide. Is it an act of that social warrior, Or is this somebody who potentially had a convoluted way of experiencing the world? Frontal lobe injuries have been associated with an increased risk of violence related to the loss of inhibitory control over primal behavioral reactions to things in our environment that provoke us. All of us get really pissed off about healthcare. I can't believe sometimes how much I pay in monthly healthcare, and then when I go to the doctor once, twice a year, how much more I have to pay. It's maddening. I can't even imagine if it was related to some type of severe pain syndrome or the life or death outcome, the quality of life for somebody, me, my family, one of my kids. So it's not to say that there's not a seed of something here that would provoke anybody. It's just, did a damaged brain perceive that life experience? And then we had this very, very dramatic outcome. So there's a specific part of the frontal lobes kind of tucked underneath called the ventromedial prefrontal cortex. And if we really wanted to drill down and start to hypothesize about what went wrong in this kid's brain, I think that would be the most logical place to look. So this is the part of the brain that does a few things kind of all together, which makes it a sweet spot for an act like this. Regulates emotions, emotional decision making, processes social and moral information. And when it is injured, it dramatically increases the risk of responding with aggression and violence. And so this is because it's related to emotional regulation. Like I said, many of us know healthcare is horrible in the US and that it needs to be changed, yet very, very few people would stalk, target, and kill the CEO of a healthcare company. So it's really that tip into that decision that we are questioning. So there's a lot of moral competency that is processed in this part of the brain and our stress response. So we know that when people take cocaine, when they smoke or snort cocaine, this is the part of the brain that's affected. So think about somebody high on cocaine, right? Lots of energy, not necessarily the best decision maker. So reports in the media say after his back surgery that he went missing and that he moved to Japan. So as a psychologist, I would wonder, is this a sign of decompensation? Was he no longer able to cognitively participate in society or emotionally participate in society? Was he unable to work? Maybe he had the money to travel. And so this was a way of spending time after, he had graduated from college. It could be a very innocent explanation, but it would be very important to interview people close to him and understand how this was a change from his baseline. What I'm seeing online is he just kind of disappeared for months on end, didn't really stay in touch with family or friends. He has an aunt that is a Maryland government representative, and she said today on the news that she hadn't talked to him since 2020. Friends reportedly got so desperate to be in touch with him that they wrote on his Twitter page things like, "Hey man, I need you to call me. I don't know if you're okay or you're just in a super isolated place and have no service, but I haven't heard from you in months." Somebody said, "Hey, you made a commitment to be at my wedding, and if you can't be there to honor it, I need to know so I can plan accordingly." Somebody said, "Hey, are you okay? Haven't heard from you in months, and apparently your family is looking for you." So for someone to drop out of complete contact with their family, it's curious. And again, we're just kind of hypothesizing how these all fit together. The fourth and final option is, could it have really been a combination of all of this? So yes, he had a life-altering back injury. He had chronic pain. Perhaps he was on opioid pain medications. We know that these can also affect the frontal lobes and disrupt normal neurotransmitter activity. Prolonged use in particular can lead to noticeable changes in frontal lobe function. The truth is, severe untreatable pain also drives people to do things that are not within their normal moral compass. It's been reported that in addition to his back surgery and his chronic conditions, he had a pinched nerve. Nerve pain is extremely, extremely distressing and really can drive people over the edge. It's not justifiable, but it's something for us to think about. An old roommate of Luigi's allegedly told the New York Times that the pain was so severe that Luigi was unable to be physically intimate with a partner. So this is a kid in his mid-20s. That's a normal part of development at that time. That would surely be very distressing to somebody. He reportedly wrote about being socially isolated because of chronic pain, saying, allegedly on Reddit, "The people around you probably won't understand your chronic pain symptoms. They certainly don't for me." So we're looking for a justification. This morning, I read online that about a month ago, a month before the shooting, he was actually seen in Southeast Asia smiling on a hike, shirtless. And then there was about a month period where he was not in touch with anyone and went completely radio silent. So this, to a psychologist, brings up the idea of perhaps a mental condition that has a waxing and waning quality to it. That is possible, times of rational thought and times of a thought disorder. So this brings up bipolar disorder, possibly a medication effect, possibly a drug effect. Ultimately, time will tell. They will surely have forensic psychologists, forensic neuropsychologists all over this case. They will be using a lot of medical records to get an objective documentation trail. If this was a moderate or severe TBI, there will be acute medical records. There'll be 911 calls. There'll be ambulance reports. And there will be somebody who documented an extended period of unconsciousness. What we really need is objective evidence from a trustworthy source that doesn't have an opinion about what happened. We actually just need to know his neurological, neuropsychological, psychological history in the past to be able to predict if it's related to his decisions that he made now. So ironically, it's going to be healthcare documentation that may actually provide him and his legal team with his strongest defense. They will surely have brain MRIs from him in the past. If he did have a spinal cord injury, he will undergo a neuropsych evaluation. I can tell you that, where they're going to look at his frontal lobe function. He will have a psychiatric evaluation, and his friends and family will be interviewed to assess the timeline of how the change that he had unfolded. I want to leave you with this. I'm starting to see merch online. So we got t-shirts, we got sweatshirts, coffee mugs, shot glasses with this guy Luigi's face. Let's not do that. Let's not buy that. Let's not support that. I don't think we want to live in that type of society. I think we can agree that two things can be true at one time. We can absolutely loathe the US healthcare system and believe that this murder was morally wrong. Those two things can be true at the same time. So I would call you to contribute a respectful comment here and tell us, what do you think would be a reasonable, if there is one, explanation for why this happened? And what can we do as concerned advocates about the US healthcare system? I'm genuinely curious. I just don't want your opinion. I actually want to understand what makes you think that. Thank you so much for listening, and I'll talk to you next time. Bye.